Even though COVID-19 has spread to 110 countries and caused more than 4,000 deaths worldwide, there is still a long list of countries not showing the level of political commitment needed to match the level of the threat we all face, as is said by the World Health Organization. And the general public around the world seem to be still gathering in groups and not avoiding them, as recommended by health officials. So let's try to bust some misconceptions which could have serious negative consequences. Joining me on the Skype from Wuhan is Dr. Zhu Chou-wen, Vice President of Zhongshan Hospital, affiliated to Fudan University. He's also head of the hospital's medical assistance team for Wuhan. And from Washington, D.C., Dr. Eric Ding, a health economist, epidemiologist at the Harvard Chan School of Public Health, also an advisor to the World Health Organization. Gentlemen, welcome to The Point. So I guess the biggest misconception or confusion surrounds the mortality rate. On Tuesday, the World Health Organization announced that the mortality rate for the virus is higher than the original 2.3% estimate, which is actually closer to 3.4%. So, Dr. Zhu, you have been in Wuhan and you have seen very closely how the situation unfolds in the hospital that you have been helping, and I understand you have been helping severe cases infected with the virus. What has been the observation from your perspective?
I think the situation in Wuhan is getting better now, definitely, and the severe cases have been treated and turned to mild cases and discharged as well. But also still we have quite many in-hospital cases. Say yesterday, the President Xi Jinping said that there are around 18,000 cases, in-hospital cases. Among them, 4,701 cases are severe and very severe cases. So we're still facing a huge task for us.
What about the mortality rate then? What has been the figures among the severe cases that you have been paying attention to, Dr. Zhu?
Yeah, I think generally saying the severe cases definitely with the relative high mortality rate, but I'm not so clear about the definition of the mortality rate 3.4 currently announced by WHO. Since in China we have such a long period of fighting with the disease, more than 2 months already, but globally they've just started. So the 3.4, I think it's just a temporary ratio of the cases who died when, for those who got diagnosed and died, above those who get diagnosed.
Okay,
so it's not the real, it's not the final mortality rate.
It's not the final mortality rate. Yeah, so what is a number that people can use to understand, let's say, based on the knowledge that we have at this moment, the danger posed by this virus then, Dr. Zhu?
Yeah, the danger, you may say, is there, but we have to estimate how large it is, since this kind of estimation is important or crucial for us to decide our behavior. And also, it's crucial for the government to make that decision. I know that in China, in Wuhan, that the mortality rate or case fatality rate, I said more exactly, is around 5% in Wuhan. But in other provinces outside Hubei province, it's around 1%.
Is around 1%?
It's around 1%. So previously I was told that globally, when in Japan or in States, the mortality rate or case fatality rate is around 1 to 2%.
Okay.
So then it's the danger is there, but you have to estimate by different situations, by your own thinking and also the surroundings. Yeah.
I see. Dr. Ding, help us understand exactly what's the level of threat that we or people are potentially faced with at this moment, because there are people who are trying a simplistic approach and comparing to a seasonal flu and saying the fatality rate of a seasonal flu is also 1% or even less than 1%, so people don't really have to worry about the coronavirus. Is it true to understand it that way?
Yeah, what you have to realize is the case fatality ratio changes depending on situation. In any situation in which the number of cases exceeds the healthcare capacity, that is when the mortality will soar way above normal. And the seasonal flu, for comparison, has a, first of all, we know an R0 of only 1.3, which is the reproductive number of one person infecting 1.3 others, while this is 2 times that fold. And the seasonal flu has a mortality of 0.1%, while this one has, I believe, between 1 and 3% on average. And remember, there is underdiagnosis, which can bring it down, but at the same time, you have to follow this disease course for up to 6 to 8 weeks, because severe cases, according to WHO, which is 20% of the people, are sick between 3 and 6 weeks. So you actually have to follow someone for a long time, and that actually can increase the mortality over time. This is why it depends. Have you exceeded your hospital bed and ICU capacity, or are you under it? And if you're under it, the mortality will be closer to 1%.
So basically the reason...
Like some parts of Italy, it'll be very high.
So basically the reason why Wuhan suffered such a high rate at the beginning, Dr. Zhu, is precisely because the hospitals were overwhelmed. There were not enough beds or medicine to treat people. Is that why so many people were dying back then?
Yeah, I think so. I agree that that's the reason that why the government sends our hospital and other hospitals from other provinces to come.
Okay.
And they also turn quite many wards into infectious to severe wards to host these patients.
All right.
So
basically, you have been saying is that if you have enough hospital beds, if you have enough medical attention, medical treatment or medicine, then you can bring down the fatality rate considerably. So, but that means that you don't have a large number of people falling ill at the same time. Then let me ask you about the exposure, the difference in exposure or the vulnerability of different age groups. Some people we have seen, as reflected on social media posting, such as this one saying, you're only 22, COVID-19 don't affect younger people like older people. How much shall we believe in that, and how much more nuance shall we look at the age difference, Dr. Zhu?
Well, age difference is there, and with the different severity of the diseases. But it doesn't mean this virus doesn't attack the young generation. Still, there's something of the mechanism that we are not so clear, but also the toxicity of the virus. There's also first generation, they have more high toxicity to the population. And the young doctors like Dr. Liu Wenliang, also his colleagues were attacked and also got to very some fatal situation. But generally speaking, the old generation with some basic diseases, with comorbidity, definitely they have more these chance to go to the end of their life.
When you say old and young, what is your definition, Dr. Zhu?
Well, here well, I cannot say it more exactly, but for us, not me, have done this research or general survey. That's around 50 to 60 around,
You mean 60 and above would be considered older, according to your definition? All right. How about, Eric, you wanted to add something here?
If I may interrupt. Yeah, so the data that clearly shows among young adults 20 to 40, 40 to 60 have 40% higher risk. 60, 80-year-olds have 2-fold higher risk, and those older than 80 have 5-fold higher risk than compared to young people 20 to 40. That came out from the latest study. And children 0 to 10 have 67% lower risk than young adults 20 to 40. So those are the exact numbers.
But the age group is different.
Age group is different. Is there a difference between Asians, Caucasians, African, or is there a difference between this biological racial line, Dr. Zhu?
I have no data for that.
You have no data. Eric?
Yeah.
There's no cross-racial comparisons yet, but we know gender-wise, men are at 10% higher risk than women.
Okay.
Maybe it's because of smoking in China, but that's all we know right now besides the age.
All right. One last point I want to touch upon is the cruise ships. I mean, we've seen very dramatic differences in the handling of different cruise ships so far, and now there are still people going on cruise ship because, for instance, thousands of passengers still boarded this ship called Norwegian Sky on Monday in Miami, and here are some of the remarks about the virus. For instance, this 20-year-old student says, if we sanitize, it will be fine, and then another says, worst comes to worst, we get quarantined, and then other people say if he's going to avoid contact with a lot of people, he should be fine, but if you do, wash your hands. Dr. Zhu, should they be relaxed about things and still continue with their plans about a cruise line vacation?
But I think it also depends the tourist group who get on the cruise, whether there are some patients or even some ones in the incubation period, there may have some transmission of the diseases. But so we still have to do some epidemiological study for those tourists. But I think then going for a cruise is kind of a lifestyle. And when we tell the population the truth of the situation among the different groups in different regions, and that also means the different risks they are facing. If the risk is high, surely the government or some authorities need to say something. But if the risk is not so high, I don't have the definite number, but it then gives the population, the tourists, to make the decision. And I think education is also important, how to avoid these close contacts, and teaching them, educating them for some methods to help themselves. It's a very tough decision then.
Yeah, okay. Eric, finally, from your observation of the kind of education process to the general public, getting them aware of the situation, do you think there are any other misconceptions that need to be addressed that we haven't?
Yeah, so, first of all, the cruise, I want to make one point that actually, from the Diamond Princess, over 1 in 5 people tested positive. And many times it's not the passenger's fault, it's oftentimes the crew is also infected. So you can only be so aware. In terms of misconceptions, the other misconception I feel like is the incubation time, which is a quarantine, leads to quarantine time. There's new studies that show the incubation time could be much longer than 14 days. That there's a new study that actually could be up to 15.5 days, which means a quarantine of 14 days may not be long enough. And we have to consider public policy that actually extends the quarantine time to perhaps 16 or 18 days.
Dr.
And
Zhu?
these are kind of things that are really critical for containment.
Yeah, Dr. Zhu, do you want to add on that? What is your observation, or what is China's conclusion after rather successfully containing the virus by now?
Yeah, also I think the incubation days is much longer than 14 days. I agree, since we have some cases that we suspect that they have 40 days or something. But I think this means that we haven't realized that virus and the disease is caused very clearly. The pathogenesis, the disease caused so clearly. So we still need to do more researches and give more observations and researches for this.
Yeah.
And it takes time. It takes time, but still we need to do that.
Yeah. Well, 14 days is already a long time for a lot of people.
Yeah,
in terms
already
of
a long time.
socio-economic cost, it's already pretty
Sure.
high. So everybody has to strike a balance. Anyway, it's not black and white. A lot of information is out there, so we need to prepare ourselves. Many thanks to Dr. Zhu Wen from Zhongshan Hospital in Shanghai and Eric Ding from the Harvard Chan School of Public Health. You've been watching The Point with me. We'll take a short break, and when we return, schools in 32 countries so far have shut their doors, hoping to help contain the virus. Is this the right move? What are the consequences of the closings? There's a lot to talk about. The spread of COVID-19 has triggered a wave of school closures around the world. According to UNESCO, the UN's Youth Agency, as of March the 10th, 32 countries have announced or implemented school and university closings, impacting over 360 million children worldwide. Another 16 countries have implemented localized school closures. So what is the impact of school closures on students and their families and societies? What measures could be helpful during these difficult times? I'm pleased to be joined from South Carolina by Shi Lu, Associate Professor from the Department of Public Health Sciences at Clemson University, and from Beijing via Skype by Professor Guo Yingjian from the School of Foreign Studies at Renmin University of China. Gentlemen, welcome to The Point. Now, Professor Guo, let me go to you first. China is taking measures to continue schooling without opening schools, let's say nationwide. The starting date of the 2020 spring semester is still unclear. In mid-February, the Ministry of Education launched the National Online Cloud Classroom, a free online learning platform for primary and secondary school students studying at home. The universities were encouraged to put their classes online. So, Professor Guo, how effective has online learning been for you 2 weeks on, and what have been the challenges?
Well, it's a very serious situation now. Schools are all closed. And China, as you know, was the first country that closed all schools. Which at first caused a controversy. But now we've had more and more announcements from colleges and universities around the globe. And you know, in China, universities have their own policies with considerable variation from one to another. Mm-hmm. But my university, first of all, has organized the emergency management teams and different groups to meet regularly, very often and even every day, and discuss possible scenarios surrounding the coronavirus and its spread progress. That includes overall management of the university and how coursework is conducted. Second, the university had suspended in-person classes, but chosen some major courses from each school and department, and let them conducted online teaching and remote learning. And I do support the online education, and I believe in the effectiveness of virtual instruction. Okay. So I think.
Yeah, Professor Guo, let me ask you this more clearly. So you are supporting it. Yes. You're supporting this because you don't have a choice, or you're supporting this because it is working?
Well, on the one hand, it is the only solution to that. So you have to choose this. But on the other side, that you know, this is the time that in crisis, people have to choose that.
I see. Okay, let me go to Professor Shi. With no national policy in place, the U.S. is also seeing localized decisions. Some schools closed, and selected schools in some states are following some kind of choices of diverting their classes online. Are you for this kind of policies in the United States? Why or why not?
In general, I understand why people started out by closing school, because that's the natural reaction when people cope with a major outbreak of the influenza. So it worked in the case of influenza, but this might not be the first thing you do when you are dealing with this SARS-CoV-2 or the COVID-19, because it affects the elderly. And it does not affect the younger children as much. So we need to be very, very careful. If the priority is to close down the elementary school, the kindergarten, the preschool, that might make it harder for the healthcare professionals to go to work in hospitals and nursing homes. And that actually might make the society more dangerous rather than safer. For universities, colleges, I think it's okay to close down.
Professor Guo,
and switch to the online teaching.
Yeah, Professor Guo, it is also a concern in China, right? Because you often have both parents working, and now one of them, at least one of them, will have to stay at home to take care of their kids who has to be educated online. How is China dealing with this challenge then?
Sorry, I didn't hear you. Are you asking me?
Yeah, Professor Guo, I'm asking you, in case a child has to stay at home to be educated online, how are Chinese families dealing with the situation? Do you have, well, your students are university students, but according to your knowledge, how do you think Chinese families are getting by?
Yes, and we do have a lot of online courses right now, and a lot of kids have to stay at home, and the parents and also the schools have to provide all the virtual instructions for them. And in my university, we also have a lot of major courses, to be conducted in the online instructions for the students, and we have already expanding this, and we'll have a lot more courses online, and also providing a lot of digital resources for them to use.
What about the students who don't have that kind of resources, Professor Guo? What are they doing? Or it is assumed that every student had the access to an adequate smartphone or subscription, their data volume subscription, so that they can watch the video or follow the live streaming. What is happening in your class? In my school, that we have provided some platforms for them to use, like a Tencent, conference. We have a lot of other platforms for them to use, so that the students can use the cell phone, they can use the laptop and the computers. They all can use all of these facilities to access to the online courses. Let me go to Professor Shi and ask about university closure. Just now you said, you said that university closure is probably okay, but it is still causing some controversy. For instance, on Tuesday, Harvard University announced it would shift to online, and it also took a further step by asking students to move out of their dorms by Sunday. So there are different discussions going on. For instance, this person says, as a resident tutor at Harvard, I'm begging the university to support students who can afford extended summer storage, will immediately add to at-home food costs and have no quiet place in which to study, or lack Wi-Fi for online class access. We cannot fail them in this. However, there are other people who are saying asking students to leave was a hard decision, I'm sure, but the right one. While I attend Ithaca College in upstate New York during 9/11, you could hear a pin drop on campus, but classes continued. Given the world catastrophe of these matters, strategizing at home is better. So, Professor Shi, how do you look at these discussions, and is there any help given out for students to help them cope with these, or they really have to be on their own?
Yeah, I'm actually less worried about Harvard or those, the elite universities with high endowments, because I believe they have the financial resources to help their students to go through this kind of situation. And it makes sense for the universities to ask their students to move out of the student dormitory, because indeed that actually could be the most dangerous spot on campus. It's not a classroom building, it's not an office building, not the lab, it's the student dormitory when people spend most of the time. And you can view them as like a stationary cruise, where a lot of people live in a closed space. So it makes sense. But on the other hand, the universities and the families and the community in general need to work together to make sure that students have alternative accommodation plan and the connection plan, data connection plan, to continue with the life and education.
All right. Professor Guo, once again coming back to China, how much longer do you think this online new normal is going to continue, and what will be the legacy, let's say, from this extraordinary period of time, which would impact on the normal teaching methods, in your opinion?
Well, I'm not so sure how long it will be, but I do think that maybe will last longer than we expected. And as previously I said, that I do support the online education, and I believe in its effectiveness of virtual instruction. But you know, the legacy of that is that we have to think about what is the significance of the campus education, because the biggest challenge that the school closures right now bring about is, can we guarantee the quality of online education? Mm-hmm. If so, and we must, of course, people will reflect the real meaning of higher education, I mean our campus education. What is the significance of campus education? I mean, if we have a positive answer to the online education, which means if we do have the best quality of teaching, like what is conducted in in-person classes, then people will ask, what else do we want at a physical university? If it fails, then we will lose the times. So I think this is the legacy that we will learn.
So we probably appreciate
right
schools more. We'll probably appreciate campuses more.
Yeah, I agree. Maybe.
Yeah. All right. Well, let's hope that this abnormal situation will come to a close as soon, as early as possible, that the situation in the United States doesn't get much worse than this. All right. Many thanks to Professor Guo Yingjian joining us from Beijing and Professor Shi Lu joining us from the United States. And with that, we come to the end of this edition of The Point with me, Liu Xin. As always, you can follow me on Facebook and Twitter using the handle The Point with LX. Thanks for watching. You've got The Point.